Hello everyone. So here is an interesting case scenario. You see a patient with these ocular and dermatological findings where you see in the iris there are some pigmentary lesions, and that is called as lesion nodules. These are called as lesion nodules, which are nothing but the pigmented hematomas of the iris. Lesion nodules are pigmented hematomas of the iris. Hematoma is nothing but the local benign tumor of the mature cells. So, when it becomes pigmented in the iris, it is called as lesion nodules, and these are the multiple neurofibromas present in the skin, and in the axilla, this finding is called as axillary freckles, which is nothing but this skin lesion is due to increased melanin production, and this is due to increased melanin production and not increase in number of melanocytes. So the examiner may confuse you with these options. So this hyperpigmentation in the axillary regions is called as axillary freckles. Is due to increased melanin production and not due to increased number of melanocytes. And then this skin lesion is called as cafe au lait spots. So, and probably from these findings you might have diagnosed by now. So this condition is called as neurofibromatosis type 1. Why I say type 1 is this lesion nodules is present only in type 1 and not in type 2. So lesion nodules is pathognomic for neurofibromatosis type 1, and it is a genetic autosomal dominant disorder, and the defective gene is NF1 gene, neurofibromatosis 1 gene, and that gene is present in chromosome number 17. And here is the diagnostic criteria for neurofibromatosis. Presence of any two of the following features would be there for diagnosing neurofibromatosis, and these are those cafe au lait spots, and these spots should be more than 6. And axillary and inguinal freckling, as we seen in this case, there are some axillary frecklings, and this axillary freckling has got some unique name called as Crow sign. So when this axillary freckling is present, is called as Crow sign, and it helps in the diagnosis of neurofibromatosis. And lesion nodules, which is pathognomic for neurofibromatosis type 1, it is not present in neurofibromatosis type 2. And multiple neurofibromas, as we seen in this case, there are multiple neurofibromas, right? And it is optic glioma is also one of the features. Optic glioma is nothing but the tumor that arises from the optic nerve. So that is called as optic glioma, and some skeletal defects like scoliosis and pseudoarthrosis. And also neurofibromatosis is also associated with certain tumors like pheochromocytoma, like that. So from these features, it is a typical case of neurofibromatosis type 1. Thank you.